So Bonnie is a 26-year-old mother of two children. She has come in for some low back pain. I have looked to make sure there's no inflammation. There's the only kind of symptoms that show up are palpation, tenderness, and again tenderness with bending over. And this is within the paraspinal muscle area at the level of the L5 vertebrae. She would be in the remodeling phase, if anything. So I have decided that we are going to do ultrasound, a thermal ultrasound, because she is in the chronic phase. And so some of the things that the thermal ultrasound could help with is kind of just like helping rebuild that tissue, and with the remodeling a little bit more of that soft tissue in that area, and increase tissue extensibility, so that we can make sure that she is warmed up and that there's no tightness associated with her pain. Some of the contraindications that we would look for her is to make sure that she is not pregnant anymore, especially since we're going to be going in that trunk area, lower trunk area, and make sure that she isn't diabetic or has any kind of weird loss of sensation, especially to heat, so that we don't burn her. And so, yeah, let's get started. Hi Bonnie, how are you doing?
You're good.
Alright, so today after some thinking, I'm thinking that we should do some thermal ultrasound. Have you ever had ultrasound before?
No.
No? Okay, so let me kind of explain how it goes. So this is the ultrasound machine over here, so I'm just going to be taking the head of the ultrasound, and it's just going to be applied to your skin in the kind of affected area in your back where that pain is happening. So in order to do that, I kind of want to ask you a couple questions. Is there any chance that you might be pregnant?
No.
Okay. And have you experienced any kind of loss of sensation in that area?
No.
In order to do this, I would like to be able to lift up your shirt, and is it okay if I place my hands on your back and the ultrasound machine on your back a little bit? Is that okay?
Yeah.
Okay. So first I'll just kind of have you lay down on your stomach. Alright. Do you mind lifting up the back of your shirt a little bit?
Sure. Golden Valley Junior College.
Okay, so I'm going to place my hands on your back, and you let me know if you can feel that.
Yes.
Awesome. Okay, so it looks like everything is good there. Alright, so to make sure that we don't get the gel onto your clothes, is it okay if I tuck this towel underneath just your pants line right there?
Yeah, that's fine.
Okay, thank you.
My girlfriend's sister went to.
She is chronic and we want to do the thermal ultrasound. We are going to put this on continuous and 100% duty cycle. We want to go a little bit deeper, so we're going to do the 1 megahertz, and we're going to turn the intensity up to 1.5, and we'll do that for about 8 minutes.
My hands on your turkey neck.
What?
This might be a little bit
You
cold.
have a turkey neck?
No.
Sorry, it's a little cold. I
Tyler has a
know.
turkey neck. What does that mean? I don't know.
She doesn't know what it means.
Whatever. Idiot. Well, you have one now, so it's fine.
Okay. No, I don't.
How's that feeling so far?
Cold. No.
Do you feel anything at all right now?
No.
I mean, you said that, so I went.
If you start to feel any kind of zinging or pain or anything, let me know and we'll stop, okay? Or at least turn the intensity down.
My computer's
Alright.
And I was like, because I was sitting here.
Just stay there for a second.
And he was like working.
How did that feel?
Feel pretty good.
Good? Was there any pain or anything?
No.
Was it a good first time experience for ultrasound?
Yeah.
Awesome. Alright. Doesn't look like any red marks here. So skin's looking great. Awesome. Thank you.